Hello, good afternoon, everyone. I am Dr. Anoop Varma, and I am working as a consultant neurosurgeon in Thodupuzha, Kerala. So, what I'm going to speak about is the do's and don'ts of patients with epilepsy for the patients and for the bystanders or the caregivers. So, coming directly to the do's about the patients, the most important thing about an epilepsy patient or an epilepsy kid or a patient with having seizures is to have regular medication intake. Taking the medications at appropriate time is the most important thing. Second is to have a healthy lifestyle, which includes food, which include proper diet, which include proper exercise, proper management of stress, proper healthy lifestyle, healthy thinking, positive attitude. These are all important for patients with epilepsy. The other most important thing about patients with epilepsy is to avoid alcohol and all sort of drugs. The other important things is to avoid overstimulation. Don't overstimulate either using alcohol or either using caffeine or either other things. Have proper sleep. The sleep itself will make you more comfortable, and sleep deprivation is a known and scientifically proven thing that the epilepsy or seizure can become. Avoid stress. That is also a triggering factor for epilepsy. The most important don'ts include, I already have mentioned regarding substance abuses and drugs and all. The other things include avoid swimming alone, avoid hiking the mountains alone, avoid working with heavy machineries, and avoid trekking and high risk jobs alone. The most important question that a patient, bystander, or maybe like the patient himself or herself will be asking would be whether can I play football? Because there are a lot of kids that who enjoy football, but patients with epilepsy are supposed to avoid contact sports, which include football, kabaddi, hockey, and all sort of things. So they are entitled to have badminton, or they can do cricketing, cycling, all sort of things they can do, but avoid contacts. Other thing is avoid overstimulation. Don'ts include excessive sleep deprivation and highly stressful situations. We can say that we can avoid, but yeah, you should know how to manage stress. That is very important for patients with epilepsy. The advices for the bystanders or maybe like the parents include your kid may have a medical condition underlying. Don't compare them with the other kids who doesn't have an epilepsy. Your kid will be having some special qualities or special skills, or they will special talents that the other kids may not be having. Try to nurture the talent and don't unnecessarily compare them with others, and always be with them. Saying always tell them that I am there with you. So that will all help those kids for the motivation and for coming out of this stressful situations. Other don'ts include don't try to always overprotect your kid. The overprotection itself will be harmful in the long run. And always be avoid traveling, just saying that, yeah, my kid has got seizure, so I'm not going to travel. No, take proper medications, have doctor consultations regularly, hike up the dosage of medications, or maybe add up other medications so that the patient is completely seizure free. The most important factor in this is avoiding recurrent seizures or avoiding seizures completely, because each seizure has got a short circuit like thing in your brain. What will trigger is that will have more brain damage or maybe like adjacent brain damages around the seizure activation areas. So regular hospital consultation, proper diet, proper exercise, have a long-term goal, being positive in life is the thing that we all require, and that is what patients or bystanders with epilepsy require for the future. Thank you.